Welcome to Close to Home, where we explore issues happening right here in our own backyard and all around North Central Florida. Today we're taking a closer look at diabetes and a condition known as Diabetic Peripheral Neuropathy.
Today there are 18 million diabetics in the United States. Diabetic peripheral neuropathy is a problem that occurs in more than 50% of the persons who have diabetes.
Diabetic peripheral neuropathy, or DPN, is a progressive disease, and symptoms vary from patient to patient.
Tingling, mild numbness, which may not be painful, to very painful situations where nerves are overstimulated, sometimes with stimulus which would normally not be painful. It also can lead to weakness. It can contribute to injury of the extremities, which is a factor that leads to the most common cause of non-traumatic amputations in this country. In having neuropathic pain, people frequently experience sleep disturbance, anxiety, and depression.
Occasionally, individuals discover that they are diabetic in seeking help for why they're developing the symptoms of DPN.
Diabetic peripheral neuropathy has a classic glove and stocking distribution, usually beginning in the feet, moving up the legs, in the fingertips or moving up the arms, and is almost always symmetrical, is a hallmark of diabetic peripheral neuropathy.
Diabetes and DPN are becoming more common around the country as well as in North Central Florida.
We are seeing more younger people develop diabetes. Diabetes is developing earlier. It is a health concern because the development of diabetes is associated with weight, and obesity is a national epidemic, and we need to watch carefully the factors that lead to the onset of diabetes. Certainly family history plays a role. Some ethnic groups are more at risk, but a very identifiable common risk factor is overweight. Preventive efforts to avoid diabetic peripheral neuropathy are those to avoid becoming diabetic. Those include, and most important, are maintaining an appropriate weight loss if overweight, and maintaining regular physical activity, proper nutrition. Treatments for diabetic peripheral neuropathy include several classes of medication, and those most commonly used are medications that are used for depression, anticonvulsants, or medications that help and modulate the electrical transmission of impulses through nerves. New medicines have been approved in recent years which are very much superior to our older medications so that people can have relief of their pain.
If you think you or a loved one may have DPN and want to learn more, visit with your primary physician.